Welcome to the Advanced Cardiac Life Support chapter on the physiology of the heart. The electrical activity of the heart is graphed in a wave pattern on an electrocardiogram or electrocardiograph, which many refer to in short as ECG or EKG. With each heartbeat, an electrical impulse or wave travels through the heart. This wave causes the muscle to contract and pump blood from the heart. An ECG is a test that measures and records this electrical activity that is passing through the heart. Based on the electrocardiogram, you can determine whether the electrical activity of the heart is normal or irregular. To understand the pathology on an ECG, it is important to know how a normal sinus rhythm or NSR functions. Sinus rhythm refers to the pattern of your heartbeat. A NSR is the rhythm of a healthy heart. One heartbeat produces a group of waves called P-QRS-T deflections. The sinoatrial node, the pacemaker of the heart, produces the P wave. The P wave is the electrical activity of the atria, and so when the atrium is stimulated, the impulse is recorded as P wave. As the name suggests, the QRS complex contains Q, R, and S waves. The QRS-T complex shows the electrical activity of the ventricles. The QRS complex shows the depolarization of the ventricles, and the T wave shows the repolarization of the ventricles. Like with the P wave, the QRS complex starts just before ventricular contraction. The QRS complex has a series of 3 deflections that reflect the current associated with the right and left ventricle depolarization. By convention, the first deflection in the complex, if it is negative, is called a Q wave, and the first positive deflection in the complex is called an R wave. A negative deflection after an R wave is called an S wave. The PR interval shows the time the impulse takes to travel from SA node to AV node. It is a good measure of any cardiac problems related to the AV node function. P wave, QRS complex, and the T wave together at the right intervals imply as normal sinus rhythm. The lack of normal sinus rhythm is an arrhythmia, or an abnormal heart rhythm. This was the chapter on the physiology of the heart of our Advanced Cardiac Life Support course. Please proceed to the next section of the course to learn more.